Questions without notice. The Leader of the Opposition.
Thanks, Mr Speaker. My question is to the Prime Minister. Counsel assisting the Aged Care Royal Commission said, and I quote, "Neither the Commonwealth Department of Health nor the Aged Care Regulator developed a COVID-19 plan specifically for the aged care sector. Why didn't the Prime Minister have a plan to protect aged care residents from COVID-19?
The Prime Minister has the call.
Thank you, Mr Speaker, because we had a plan, Mr Speaker, and we reject the assertion that has been made and have done so in evidence to the Royal Commission, Mr Speaker, by the Secretary of the Department of Health. On the 18th of February, the overarching plan for management of COVID-19, the Australian Health Sector Emergency Response Plans for novel coronavirus COVID-19 was released. On the 27th of February, the pandemic was declared and the response plan was activated. On the 2nd of March, the Aged Care Quality and Safety Commissioner wrote a letter to all aged care service providers regarding planning and preparing for COVID-19. On the 6th of March, the Aged Care Preparedness Forum was held with Minister Colbeck, the Chief Medical Officer and the aged care sector. On the 13th of March, the Communicable Diseases Network Australia published the National Guidelines for the Prevention, Control and Public Health Management of COVID-19 outbreaks in residential aged care facilities. On the 17th of March, the medical expert panel, the HHPPC, released recommendations to residential aged care facilities, ensuring they are prepared to manage outbreaks for COVID-19. On the 28th of March, the CDNA published an updated COVID-19 guidelines for outbreaks in residential care facilities. Updated focuses on clinical presentation in older people and infection control guidance. On the 2nd of April, there was a guide to outbreak management and guidance on alerting the department about confirmed COVID-19 cases in aged care that was released. On the 2nd of April, Infection Control Expert Group, which reports to the HPPC, released guidelines for infection prevention and control in residential aged care. On the 22nd of April, Mr Speaker, the AHPPC updated advice to the residential aged care facilities about minimising the impact of COVID-19, and that was released on that day. On the 19th of May, the CDNA released guidance for health and residential aged care settings on considering monitoring workers for the symptoms of COVID-19. On the 7th of July, Minister Colbeck wrote to aged care providers reminding them to have an update outbreak management plan. On the 14th of July, the CDNA published updated COVID-19 guidelines for outbreaks in residential aged care facilities. That update focused on outbreak identification and management guidance, roles and responsibilities of government agencies and additional members for the outbreak management team. There was a plan, Mr Speaker. The plan was regularly updated and advised to the sector, and the plan continues to be implemented with over $1 billion of funding from this government.
The member for Lingiari will cease interjecting. Yeah, well, it's a long way to come to get thrown out. The member for Goldstein has the call.
Thank you, Speaker. My question is to the Prime Minister. Will the Prime Minister update the House on how the Morrison government is driving Australia's economic and health recovery from the COVID-19 pandemic?
The Prime Minister has the call.
I thank the member for Goldstein for his question, Mr Speaker, and I was very pleased to join the member for Goldstein when we connected with thousands of residents in his electorate as we sent our support to those in Melbourne, in particularly in his community, to provide them not just with the answers to their questions as they raised them on our telephone town hall meeting, Mr Speaker, but also to give them encouragement and to thank them for the sacrifices they are making each and every day. We welcome the fall in the number of new cases each day in Victoria, 116 today, sadly, an additional 15 deaths. And again, we send our sympathies and condolences to the families who have lost loved ones during this crisis, and particularly in the last 24 hours. Mr Speaker, we are turning the corner in Victoria, and we are very pleased to continue to support all the efforts of the Victorian government as a Commonwealth government to assist them as they get control of what has been a very significant outbreak as the Victorian wave that has impacted Australia and had such a devastating effect, not just in Victoria, but the ripple effects across the economy and the other restrictions and things that have been put in place in other parts of the country that have affected so many parts of our great nation. There has been unprecedented support, though, to our economy, as I noted in my early remarks, to ensure that we are there to support and aid Australians in what has been their most difficult hours during this crisis. Over $100 billion, Mr Speaker, in support through JobKeeper alone, but in responding with the doubling effectively of the job seeker payment through the COVID supplement that is extended far and wide across the country, Mr Speaker, and the Herculean task done by those wonderful officers at Services Australia, which at one time even included members of the Parliamentary Services Department itself, answering phone calls in committee halls in this very building to ensure that Australians could get access to the payments that they needed to help them get through. An absolutely extraordinary effort from our public service to ensure that these incredible backlogs and numbers of those seeking assistance was able to be addressed in a matter of months, when normally that same number of applications wouldn't be seen in several years, Mr Speaker. The Job Maker plan that I've already set out to the nation when I spoke at the National Press Club many months ago, Mr Speaker, and a keen focus of that plan is to ensure that we get young people into work, Mr Speaker, who have been most affected by this crisis, and indeed women, Mr Speaker, who have also been most dramatically affected economically by this crisis. And the good news is the Treasurer, Mr Speaker, has already been highlighting today, is that those most impacted through job losses through COVID-19 are also those who are regaining their jobs now as we continue to reopen our economy. And it is important that we do reopen our economy and that we get the balance right between the health needs and the economic needs, and we continue to stress those issues as the National Cabinet meets, Mr Speaker.
Has concluded. I now call the Deputy Leader of the Opposition and member for Corio in his office in Corio.
Thank you, Mr Speaker, and my question is to the Prime Minister. The Health Department says 328 aged care residents have died from COVID-19. How many more aged care residents have to die before the Prime Minister accepts full responsibility for keeping them safe?
The Prime Minister has the call.
Mr Speaker, I thank the member for his question, and I join with him, and I'm sure all members in this place, as we grieve the deaths of so many Australians who've succumbed to this virus, not just those who are older, Mr Speaker, but all those who have been affected, either with serious illness, or those who have ultimately succumbed to that virus. The Commonwealth is responsible, as I set out in the statement the Leader of the Opposition referred to earlier, for all of the issues that he referred to in his statement. And I stand by that statement, Mr Speaker. The Commonwealth is responsible for the funding and the regulation of aged care services in this country. But it is also true in the course of a pandemic, Mr Speaker, that there are responsibilities that are held by other agencies of the Federation, in particular the state governments. And so, Mr Speaker, when it comes to managing the crisis in aged care, we must work together with state governments, and that is exactly what we're doing. Mr Speaker, we are combining our responsibilities to together work to the plan that I set out, and that was set out by the government over many months and restored by its refreshing and its updating based on the best available evidence. We are working together with the Victorian Government on that plan, Mr Speaker. We both have responsibilities here. The Commonwealth is responsible for aged care facilities when it comes to their funding and their regulation and their clinical practices, Mr Speaker, and that is what we are overseeing. But we are working together with the State Government of Victoria to ensure that the broader public health issues, when you have a pandemic of the scale we've experienced in Victoria, Mr Speaker, that we ensure that the two systems work together to get the best result. We share those responsibilities. That's why I speak regularly with the Victorian Premier about these issues. That's why the Victorian Aged Care Response Centre is led by the Commonwealth and is staffed by both representatives of both the state government and the federal government to ensure we get the best possible response, which involves the transfer of residents to public and private hospitals in Victoria. It involves the visitation by the public health officers from the Victorian government and the notification of federal officials and federal agencies when testing is being done in those facilities. Mr Speaker, it is simplistic to seek to apply such a binary representation of this issue. This is a complex pandemic. The responsibilities are clear, and we will meet our responsibilities, and we will work with everyone in this country who wants to work with us.
And I call the member for Stirling.
Thank you, Mr Speaker. My question is to the Treasurer. Will the Treasurer outline to the House how the Morrison government's plan for jobs growth is supporting Australian businesses and families during this pandemic?
The Treasurer has the call.
Thank you, Mr Speaker. I thank the member for Stirling for his question and acknowledge his distinguished service as an officer in the Australian Army, including serving abroad as well as in the private sector before coming to this place. Now, Mr Speaker, COVID-19 is a wrecking ball through the global economy. It's helped destroy some 500 million jobs, and according to the World Bank, we will see more economies contract this year as a result of COVID-19 since 1870. More countries will see their economies contract since the year 1870, Mr Speaker. Now, in relation to us here in Australia, the economic cost has been very high, and it's the highest right now in the state of Victoria, where people are doing it extremely tough with the stage 4 restrictions, and that's why, as the Prime Minister has outlined, we're providing every resource, either on the health side or also on the economic side, as possible. But, Mr Speaker, we are also seeing outside of Victoria the jobs starting to come back. Mr Speaker, our effective unemployment rate is at 9.9% today. It was 14.9% in April, Mr Speaker. In the last 2 months, we've seen 340,000 new jobs. 340,000 jobs have come back, Mr Speaker, and importantly, 58% of those went to women and 44% of those jobs went to young people, Mr Speaker. And we're seeing particularly strong growth in the state of New South Wales. And of the 1.3 million people who either lost their jobs or had their hours reduced to 0, more than half have now come back. Around 700,000, Mr Speaker. So there is a light at the end of the tunnel. The road will be bumpy, the road will be long, there is great uncertainty, but there is a light at the end of the tunnel. And this is where the Job Maker plan is doing its work in trying to get people back into work, with tax incentives, including the accelerated depreciation at 50%, including the extension of the instant asset write-off, what we're doing in bringing forward around $10 billion worth of infrastructure projects, 340,000 new positions and places, Mr Speaker, in terms of skills training and education, Mr Speaker. The work that we're doing to make it easier for businesses to stay in business, whether it's e-signatures and virtual AGMs, or the work that the State Treasurers and I have been doing in relation to harmonising occupational licensing, Mr Speaker. And of course the 50% wage subsidy for apprentices, and some 180,000 apprentices will benefit. This is the Job Maker plan. This is how we get people back into work after the biggest economic shock this country has ever seen. The plan is there and the plan is working.
The Leader of the Opposition.
Thanks, Mr Speaker. My question is to the Prime Minister, and I refer to his answer to my previous question, in which the Prime Minister claimed there was really an aged care plan for COVID-19, even though his own Royal Commission, with all its resources, days of expert evidence and access to documents, couldn't find it. After 328 aged care residents have died, why should Australians believe the Prime Minister instead of his own Royal Commission?
The Prime Minister has the call.
Speaker, I have set out very clearly before this House the plan, its updating of that plan, the communication of that plan and the implementation of that plan, Mr Speaker. And I'm invited to outline the timetable, Mr Speaker, again. And, Mr Speaker, if the members would like me to do that, I will go through it all again, if it would be of assistance to the House, Mr
Members
Speaker.
on my left.
But, Mr Speaker, we have set out very clearly that plan. And that plan has been available since March of this year and has continued to be refreshed and reported to the aged care sector. and worked through in webinars and other information, including with support by the Aged Care Quality Commissioner as well. Now, Mr Speaker, assertions have been made before the Royal Commission, Mr Speaker, and we have rejected those assertions, and we have set that out in evidence to the Royal Commission. Now, Mr Speaker, I welcome the Royal Commission investigating these issues. I welcome the Royal Commission undertaking its inquiries into these matters. In fact, I wrote to the Royal Commission and asked them to do that very thing. But, Mr Speaker, we're all in a position where we have to back up the assertions that are made, and where there is an assertion that is made, whether it be before the Royal Commission or any other place that asserts something that the government has not done when we believe that is not correct, then we will correct that record, and I have done so here today, Mr Speaker. And what has occurred, when we reflect again that, Mr Speaker, 97% of the aged care facilities in this country have had no COVID cases amongst residents. 97%. Now, Mr Speaker, as I said before, there has been 16
members on my left
where there have been a significant impact, and, Mr Speaker, there has been an even smaller number where there has been an unacceptable outcome. And that is indeed true. But in the 97% of those facilities, Mr Speaker, I know that residents and I know that families and others know that even, Mr Speaker, in those facilities where there have been some COVID cases, they've been extremely well managed, and that is a tribute to those aged care workers and all of those who are working to keep those facilities safe in terms of transferring of residents and providing the care that is needed in those facilities and getting those arrangements in place. So we'll continue to implement that plan. That plan is supported by more than $1 billion of additional investment in aged care supports, Mr Speaker, and we will continue to invest what is needed to ensure that our residents in our aged care are given the dignity and the care that they deserve.
And I call the member for Indi.
Thank you, Mr Speaker. My question is to the Prime Minister. For the past 7 weeks, the closure of the New South Wales-Victorian border has upended the lives of thousands of people. There is confusion, frustration, despair. In a national crisis, the role of the Prime Minister is to provide leadership to solve problems for all Australians. But yesterday, the Agriculture Minister said the closures made him feel like a forgotten Australian. According to your own minister, the coalition governments in Canberra and Sydney have forgotten people in border communities. Prime Minister, what will you do as the national leader to resolve this border crisis?
The Prime Minister has the call.
Thank you, Mr Speaker. I thank the member for her question, and I thank her for her participation in the many exchanges that have taken place by members of this place that represent border communities in New South Wales and in Victoria, but particularly those in Victoria who have been obviously more impacted, most impacted, whether it's to access work or important medical services in South Australia or in New South Wales. And ever since the decision was taken, which was an exception, I must say, of all the other border arrangements that have been put in place internally in this country, in New South Wales and Victoria, both premiers and I sat down, on the phone, and spoke about what needed to happen next, given the serious outbreak that was occurring in Victoria. The medical evidence supported, indeed necessitated, that firmer restrictions be put in place to contain the spread of what has clearly been the most significant outbreak of the virus that we have seen in Australia. Now, the restrictions that have been put in place also involved a border commissioner being established to ensure that issues as they arose could be worked through. And there have been many, as I know the member for Indi knows. And that's why I welcome, following the direct representations that have been made by the Commonwealth, including by the Minister for Agriculture, by myself and other ministers, to ensure that the New South Wales government has now extended a 100-kilometre zone in Victoria, which ensures that there can be greater movement coming out of Victoria into New South Wales to access that important job opportunities and access to medical care. Similarly, individual cases I have written at great length to the Premier of South Australia, ensuring that we're getting particularly young people who need direct access to hospitals in South Australia, and the Premier and I are working directly together to ensure that those young kids are getting that attention when they need it, Mr Speaker. So I will continue through the National Cabinet and directly through the office, the work of the Border Commissioner, which members here are very familiar with, to continue to resolve what these knotty issues are because of the establishment of that border. and there are many unintended consequences, and that's why borders in principle within the Federation are not a good idea, and we should avoid having them wherever we possibly can, and they should only be applied when the health advice absolutely demands it. Now, in the case of New South Wales, Victoria, that is regrettably the case. And I know particularly Victorians in Western and Northern Victoria are frustrated that there are no cases in those areas of the community. But it is necessary for those borders to be in place so we can get past this Victorian wave. I look forward when those borders can come down, not just there, Mr Speaker, but when it's safe to do so all throughout the country.
And I call the member for Mallee.
Thank you, Mr Speaker. My question is to the Deputy Prime Minister and the Minister for Infrastructure, Transport and Regional Development. Will the Deputy Prime Minister please inform the House how the Morrison-McCormack government is supporting local industry and communities, especially those in Victoria, through its $1 billion Relief and Recovery Fund?
The Deputy Prime Minister.
Thank you, Mr Speaker, and I do thank the member for Mallee for her question, Mr Speaker. She represents a large electorate in north-west Victoria, a third the size of that state, and she has been working so hard for her communities, so hard for those people who want the health and economic outcomes, Mr Speaker, and I commend her for her work with Cross-Border Commissioner James McTavish and others, members of this House and the other place, for the tireless efforts that they've gone to make sure that their communities get the representation and the outcomes that they indeed deserve and need. Mr Speaker, I'm asked about the $1 billion Relief and Recovery Fund. It's been an integral component since May 12 of our economic recovery plan. For those industries, those communities hardest hit by COVID-19. Mr Speaker, it is protecting lives, it's protecting livelihoods. It's on the back of course, JobKeeper, JobSeeker, Mr Speaker, Home Builder, JobMaker, all of those programs that we have put in place to help our communities, particularly our regional communities, Mr Speaker. Our regions vary vastly in their local industry, in their produce, in their exports, in their challenges and indeed their opportunities. The Relief and Recovery Fund has been specifically designed to provide the support which reflects the varied nature of our communities. $670 million of support has already been committed through this fund, Mr Speaker. The initiatives, mechanisms and procedures established or increased under the Relief and Recovery Fund are providing support across the nation in such areas as agriculture, the arts, fisheries, tourism and aviation, and such things as the International Freight Assistance Mechanism, IFAM, which has made such a difference. Daniel Byrne, Export Sales Manager of the Midfield Group in Warrnambool, Victoria, has said about IFAM, what the government has done allows Australian products to remain competitive and retain crucial shelf space required for the future of Australian red meats. IFAM has enabled us to send high-end Aussie lamb, normally destined for fine dining restaurants, to alternate markets. IFAM has enabled us to save many jobs without doubt. And I've given up. I've lost count of the number of people who've come to me, Mr Speaker, and said thank you for the assistance under the Relief and Recovery Fund, but also thank you for JobKeeper, Mr Speaker. I know that those people, it has kept their business doors open, it has kept the lights on, perhaps even more importantly, it has connected workers engaged with their employment, with those businesses, particularly in small business, Mr Speaker, and I know they are so important. I hear the Shadow Treasurer call out the only small business he likes is the one that he can do a picket line out the front of, but they mean so much to us, and we want to keep them going through COVID.
The Leader of the Opposition.
Thanks, Mr Speaker. My question is to the Prime Minister. The Commissioners presiding over the Aged Care Royal Commission said today, quote, "Had the Australian government acted upon previous reviews of aged care, the persistent problems in aged care would have been known much earlier and the suffering of many people could have been avoided." Are the Royal Commissioners correct? Prime Minister, what Australians are seeing in aged care could have been avoided. Why didn't the government and you act?
The Prime Minister has the call.
Well, thank you, Mr Speaker. I will await the findings of the Royal Commission and the recommendations of the Royal Commission before the government responds to the Royal Commission, Mr Speaker, just as we have already responded, Mr Speaker, to the interim report of the Royal Commission, which has dealt with particularly in-home aged care places, Mr Speaker, and we will have the opportunity to provide further responses to those items that were raised in the interim report of the Royal Commission in this year's budget and, if need be, Mr Speaker, the mid-year statement as well. The Royal Commission should be allowed to continue to do their work. Having commissioned it, Mr Speaker, I am keen for them to deal with all of the issues that need to be addressed and for those to be sifted through, and the Royal Commission to be able to come to its set of findings and to provide its recommendations, Mr Speaker. But I don't propose to undertake a running commentary on the Commission's hearings and commentary that has passed along the way. I think it's important that we just let the Royal Commission do its job, and I would ask, Mr Speaker, that all members of this place would join me in supporting the Royal Commission to get on with its work, Mr Speaker,
Members on my left.
and to not seek to partisanise its activities, Mr Speaker, and to adopt positions, Mr Speaker, that would only seek
Members
to
on my left.
undermine. But, Mr Speaker, what I would encourage people to do, just as our party did when we were in opposition and we were dealing with difficult issues in aged care, we supported the then government, Mr Speaker. And the reason I called the Royal Commission is because there has been failings in aged care, Mr Speaker, going back over decades. And in the interim report, Mr Speaker, that was made clear, that the failings that they are dealing with go back over many, many years, Mr Speaker. All governments, Mr Speaker, have failed to measure up to the mark, including those who are members of governments previously who now sit opposite. So we are quite prepared to get the recommendations of that report, Mr Speaker, and its findings, and to respond to those at the appropriate time.
Just before I call the next question, members on my left who've been interjecting, I made clear this morning that in a statement this morning, that I was going to be less tolerant of poor behaviour. If it was too subtle for people, let me just be very clear, okay? I mean, we're here in Parliament. There's important work to do. I'm not going to tolerate a wall of interjections for a whole range of reasons. And if members can't work that out now, they'll work it out back in their office. The member for Bonner.
Thank you, Mr Speaker. My question is to the Treasurer. Will the Treasurer outline to the House how the Morrison government's economic support packages are helping businesses and families and keeping people in jobs, especially in Victoria, while we get to the other side of this pandemic?
The Treasurer.
Well, thank you, Mr Speaker, and I thank the member for Bonner for his question, note his experience in small business before coming to this place, and the fact that in his electorate there are 5,200 businesses that are benefiting from JobKeeper. And across Queensland, there are 180,000 businesses that are benefiting from JobKeeper, and already $7 billion has gone to those businesses and their staff across Queensland. Now, Mr Speaker, the Morrison government has provided an unprecedented level of support in response to COVID-19. Some $314 billion, or 15.8% of GDP. Now, that's in contrast, Mr Speaker, to the states, who have provided around $48 billion worth of support, which is the equivalent of 2.4% of GSP, gross state product, Mr Speaker. And our response has been initially to provide income support to families and to businesses to cushion the blow with the supply-side shock, and particularly the JobKeeper program, which has been described by the Governor of the Reserve Bank, Phil Lowe, as a remarkable program, Mr Speaker, that has helped keep people in a job. And already $42 billion has gone to Australian businesses and their staff as a result of the JobKeeper payments. Now, Mr Speaker, like Tony, who's got a hairdressing training business in Mount Garrat, Mr Speaker, in the electorate of the member for Bonner, and he described it as a lifeline for his business and helping him through the recovery. Now, Mr Speaker, there's also the cash flow boost, which is supporting 780,000 businesses, Mr Speaker, $22 billion has already gone out the door with the cash flow boost, like to Wally's, Lollies, Mr Speaker, and Box Hill South in the great state of Victoria, Mr Speaker. There's also been, through our income support, the coronavirus supplement, Mr Speaker, which has supported 2.3 million people and has seen $9.7 billion out the door, as well as the $750 payments, Mr Speaker, the two $750 payments to 2 million pensioners, as well as many others on income support, and we've already seen $9.2 billion go through that program to Australian households. Now, Mr Speaker, in addition to that income support, there's also the Targeted Home Builder program, there's also the Relief and the Recovery Fund, and of course there's the $1.3 billion of support for the aviation industry, Mr Speaker. We are providing a range of economic supports to the Australian community to help get them to the other side. We were with the Australian community at the start of the crisis, we're with them through this crisis, and we'll be with them all the way to the end of this crisis.
Has concluded, and I call the member for Franklin.
And my question is to the Prime Minister. Why did the Prime Minister wait until now, 6 months into the pandemic and after hundreds of aged care residents have died, to announce the Aged Care Advisory Group?
The Prime Minister has the call.
Thank you, Mr Speaker. The announcement that was made was to add to an existing group that has already been established, Mr Speaker, and to expand its role and expand its membership. There has been consistent expert advice from infections control experts, geriatricians, and a vast array of clinical experience that has been advising the government's plans on the response to the aged care needs as a result of the pandemic, Mr Speaker. That has been occurring since early this year in both the preparation of the plans that I have already outlined to the House today, the refreshing of those plans and the communication of those plans throughout the country, and particularly to aged care service providers. So, Mr Speaker, we have added to an arrangement that was already in place. We have expanded that, and we welcome that added facility that we've put in place for those arrangements, and they will continue to assist us well as we respond to this pandemic.
And I'm going to call the member for Monash.
Thank you, Mr Speaker. My question is to the Minister for Health. Will the Minister update the House on how the Morrison government is working to contain the COVID-19 outbreak in Victorian aged care facilities, particularly through the Victorian Aged Care Response Centre?
The Minister for Health.
Thank you very much, Mr Speaker, and I want to thank the member for Monash. And he, like all members of this House, are focused on the deep needs and the tragedies that Victorians have faced. Before coming to this chamber today, I spoke with the Aged Care Response Centre and received information from my department. There are 126 facilities in Victoria that currently have some form of positive case. 59 of them have staff only. There are no facilities, to the Leader of the Opposition, you have exhibited some interest in this topic earlier today.
The Minister has the call.
There are no facilities with a positive case anywhere else in Australia outside of Victoria. Would you like to withdraw that?
The Minister, I heard the remark. I'm just going to say to the Minister, he has the call. He'd be wise to use it, and he can't compel anyone to listen to him. That's just the nature of Parliament. The Minister has the call.
All right, if they're not interested, I'll keep going, but they can choose or not choose to listen on the topic of the aged care response in Victoria. Critically, what we set out in January was that in order to save lives and protect lives, we had to prevent community transmission. That was why, because we knew around the world this is a disease which can affect the elderly, which, although any Australian, any person around the world can be subject to it, it's the elderly in particular around the world we have seen who are most susceptible. Wherever there is community transmission, there has been in every place a significant impact on our elderly. And that was why we closed the borders on the 1st of February. That's why we worked through the 6 stages of our national plan for protection of the elderly against COVID, beginning with the work in January, beginning with the national plan which the Prime Minister set out, the CDNA aged care plan on the 13th of March, and all of the other phases.
Member for Kingston.
But most significantly, as part of the mass community outbreak in Victoria, we set up the Victorian Aged Care Response Centre as a joint partnership with the Victorian Government. And that in particular has seen over 448 residents transferred from aged care homes to public and private hospitals. But under the plan which established a public hospitals agreement back in March, a private hospitals agreement back in March, and $100 million for aged care surge workforce. In addition to that, as part of that surge workforce plan, 17,000 shifts by recruitment, 2,300 shifts by Healthcare Australia. AUSMAT, 69 residential aged care facilities visited. Defence, 40 clinicians, 34 officers embedded, 100 officers deployed as part of the field. We've seen the Aged Care Quality and Safety Commission visit 83 centres, and most significantly, 13 hot facilities reduced to 3 as of this morning's briefing with the Prime Minister. So yes, there has been tragedy. There's more work to do, but what these people have done is they've worked together to potentially save thousands of lives in a crisis which has ravaged one state, but where the rest of the nation has been protected.
And I call the member for Macquarie.
Thank you, Speaker. My question's to the Prime Minister. Why did the Prime Minister say in July that a complete withdrawal of an aged care workforce could not be anticipated or foreshadowed, when that's precisely what happened at Dorothy Henderson Lodge in March and Newmarch House in April?
The Prime Minister has the call.
Thank you, Mr Speaker. I thank the member for her question. The context of the comment is what the questioner has failed to draw attention to. As the Acting Chief Medical Officer pointed out in our joint press conference last Friday, when he was asked the same question, Mr Speaker, what we were referring to at that time was the immediate withdrawal of that workforce, Mr Speaker. That is what has occurred at the facilities that you have referred to in Victoria, Mr Speaker. This was the complete, in a matter of hours, Mr Speaker, when that workforce was withdrawn, and that is the issue that presented the most critical challenge. Now, it is the case, it actually is the case, that prior to that event, of course, workforce planning had been done for places like St Basil's and other critical facilities that were severely impacted. And with no notice effectively of withdrawing that workforce, those plans were swung into action, and as many aged care workers were put into that facility as was humanly possible. On other facilities, we were arranging ADF people to go into facilities about 11 o'clock at night. Now, Mr Speaker, what was learnt out of the Newmarch process, as well as Dorothy Henderson Lodge, was the need to ensure that when facilities were dealt with in this way, that there wasn't a complete withdrawal of the workforce. And that is why, following the incidents that occurred at St Basil's and other places, we were able to get an agreement out of the Victorian Government to ensure that that process of complete and immediate withdrawal was not repeated, as it was a key contributing factor to what occurred in that facility. Now, that is an example of how the Aged Care Response Centre has been working each and every day to deal with problems and issues as they have arisen in what has been an extraordinary set of circumstances in Victorian aged care. As the Minister for Health just reminded the House, in every country where there has been extensive community transmission of the virus, it has gone and had devastating effects in aged care facilities. Now, in Australia, 97% of facilities in this country, and just over 90% in Victoria, have had no cases of COVID. Now, Mr Speaker, that compared to the international experience is a testament to the great work that is being done by those officials and those working on the ground to prevent the impacts of this virus when it moves through the community. Mr Speaker, so many aged care workers, and indeed health workers in Victoria more broadly, as I was only being briefed on this morning, when there is community transmission, it affects all workforces, and that includes the health workforces. That is impacting hospitals. There has been an outbreak in the Frankston Hospital, Mr Speaker. and we're dealing with the transfer of residents who had been transferred to that hospital. So we will continue to deal with the issues as they arise. We will work together with the Victorian Government to achieve the best results for residents who are in their care.
The member for Higgins.
Thank you, Mr Speaker. My question is to the Minister for Health. Will the Minister please update the House on the Morrison Government's coronavirus vaccine strategy?
The Minister for Health.
Thank you very much, Mr Speaker. And I want to thank the member for Higgins, who has had a distinguished career in medical research and medical treatment. We know that the search for a vaccine is one upon which the world is focused. There are over 160 clinical trials. Without a vaccine, we won't be able to return fully to the life which we have all known in the foreseeable future. This is an unfortunate but sad reality. But at the same time, Australia is deeply engaged in the 4 elements of our national strategy for the vaccine. In particular, first, there is research. We have allocated over $358 million towards research in relation to vaccines, preventions, treatments and respiratory medicines. Most significantly, there's been an investment of $5 million in the University of Queensland molecular clamp. There's another vaccine round currently underway. Funding has been provided to preventions and treatments from multiple proponents, and all of these things are helping to make Australia one of the leaders in the search for a cure. But there's also the other elements of our national vaccine strategy, and they include, in particular, direct purchasing, international engagement through the Gavi COVAX facility, and Australian-based manufacturing. In terms of the direct purchasing, we have struck the first stage of our agreement with AstraZeneca to give Australia whole-of-population access for free, all Australians for free, to the AstraZeneca vaccine if it is safe and if it is effective. That is an extraordinary breakthrough. In addition to that, we are under the process of negotiations with other possible vaccine candidates, both within Australia and around the world. Further than that, we have completed the Gavi COVAX facility stage 1, which is the stage to which it has progressed so far, where we have expressed our intent, along with other countries, to participate. And if, as we expect, it proceeds to stage 2 and it acts as a common platform for investment in return for common participation in whichever vaccine is successful, then we will be part of that. And stage 3, of course, is Australian manufacturing, and we are blessed and in a fortunate position with CSL. CSL is part of our national response, and we've been working very closely, not just the department, but the Prime Minister, myself, the Minister for Industry and others have been engaging with CSL. And we are very, very strongly placed to be able to not only acquire vaccines, but to distribute them to the whole of population on the basis of Australian manufacture, and that comes from our National Vaccine Strategy Plan.
The member for Franklin.
So my question is to the Prime Minister. Can the Prime Minister confirm the government's own report into the COVID-19 outbreak at Dorothy Henderson Lodge warned that even well-managed providers needed help to respond to an outbreak on day 1? And can he confirm he received this report in April, but it was kept secret until the Royal Commission published it this month? And why didn't his government do the things it was told was necessary to keep aged care residents safe?
The Prime Minister has the call.
Mr Speaker, the matters raised in the report are as the member has said, but the assertion that she has made following from that is not correct, Mr Speaker, because the myriad of preparations, plans and advices that were provided to the aged care sector from the government and from its various agencies have gone to the matters that she has raised. Now, Mr Speaker, in particular, that has gone to the issue of workforce preparation, that was the subject of quite specific advice and letters and even webinars and projects with the sector to go to that effect, Mr Speaker. So, Mr Speaker, I'm detecting through the course of these questions, Mr Speaker, that the opposition is of course going to raise issues as is appropriate in this parliament. But, Mr Speaker, the assertions they're making simply aren't stacking up. Mr Speaker, what we have sought to do,
Member for
Mr
Franklin.
Speaker, what we have been doing from the outset
Members
of
on my
this
left.
pandemic is to ensure that we have had a plan in place. That plan has been pulled together by the expert professionals here in Australia to ensure that we can be as best prepared as we possibly can be. That plan has been continually informed and refreshed, indeed by the reports, whether it's Dorothy Henderson Lodge or Newmarch or the other inquiries that we have now also instigated into St Basil's by the same people who have done the report into Newmarch, to ensure that the continued response that we provide and deliver on the ground addresses the learnings that come from dealing with a 1 in 100 years pandemic as it impacts on our aged care sector, as the Minister for Health has noted. In all other states and territories other than Victoria, there are no cases. There are significant cases and have been significant cases in Victoria, Mr Speaker, and the key distinguishing feature between Victoria and other states and territories has been the scale of the community outbreak that has occurred. And to that end, Mr Speaker, I commend the New South Wales government and I commend Premier Berejiklian, Mr Speaker, who, through their procedures and plans and protections, despite many challenges and many outbreaks that have occurred, they have been able to keep that under control. That has saved, Mr Speaker, hundreds of lives, if not thousands, in New South Wales. And New South Wales has been able to do that while continuing with a plan of keeping its economy open and keeping people in jobs. New South Wales are proving to be the gold standard here, Mr Speaker, and I commend them for their great work.
The member for Moncrieff.
Thank you, Mr Speaker. My question is to the Minister for Industry, Science and Technology. Can the Minister please inform the House about how the Morrison government is backing the development of a COVID vaccine to drive our health and economic recovery?
The Minister for Industry has the call.
10 years.
10 years. Thank you, Mr Speaker, and I thank the member for her question. Mr Speaker, as the Minister for Science, I've been working very closely with Australia's National Science Agency, the CSIRO, and the work that CSIRO is doing is very central to international vaccine efforts, and they have been working closely in this area since the start of the pandemic. They have been leading evaluation on vaccine candidates from the UK and the US, including the very promising Oxford vaccine. And much of this research work is actually being undertaken at the Australian Centre for Disease Preparedness, which is CSIRO's high containment biosecurity facility in Victoria. And it's actually the only lab of its kind in the Southern Hemisphere. And recently our government invested over $220 million to enhance this very important facility. Now, some of the work that CSIRO has been doing is to evaluate different administration methods of the vaccine to determine which is the most effective method. Now, we do know that early data has enabled the vaccine from Oxford to progress on to phase 3 clinical trials, where there will be broad testing of somewhere between 30 to 50,000 people. And of course, CSIRO has also been working on the University of Queensland vaccine, and trials have been commenced on that vaccine here at home in Australia. Now, both the Oxford vaccine and the University of Queensland vaccine are both very promising, and they are cause for hope. But we should all be well aware that there is no guarantee for a vaccine. There's no guarantee that either of these will be successful, but it is important that we are in the best possible position that we possibly can be when such a vaccine is made available to us. Mr Speaker, we have been very determined as a government to make sure that there are ways for us to live and to work in the COVID environment in which we find ourselves. It is very important that we look at ways that we can live and that we can work, because the first step cannot be to shut down our economy. We have been very clear from the start that this is a battle that we need to fight on a health basis and also an economic basis. What we are seeing is work from this government to make sure that we are attacking this virus on both fronts. Our businesses are working hard to make sure that they can do all that they can to remain open, and we encourage them to do that. And together, we will make sure that Australia is in the best possible position to come through this recovery.
The Leader of the Opposition.
Thanks, Mr Speaker. My question is to the Prime Minister, and I refer to his statement, I quote, "We regulate aged care, but when there is a public health pandemic, then public health, which whether it gets into aged care, shopping centres, schools or anywhere else, then they are things that are matters for Victoria." Does the Prime Minister agree there's a fundamental difference between the Commonwealth's responsibility for shopping centres and its direct responsibility for aged care residents?
The Prime Minister.
Mr Speaker, the Leader of the Opposition can seek to misrepresent those phrases as he chooses in this place, Mr Speaker, but he fails to understand the point that was being made. The Commonwealth is responsible for the regulation and funding of aged care and its clinical practices, Mr Speaker. That is true. That's what happens in aged care facilities. Mr Speaker, what I was referring to was the broader responsibilities of state governments when it comes to the management of public health and pandemics. Now, Mr Speaker, when a state government is responsible for public health and pandemics, then they are responsible for how that applies on all aspects of what occurs in that state. And that includes shopping centres, and that includes public health issues related also to aged care facilities, hospitals, schools, any type of facilities that occur, community sporting facilities, Mr Speaker. Public health is the responsibility of state governments. Now, when there is a pandemic that is reaching into the aged care facilities, Mr Speaker, then there is, of course, an overlap of those responsibilities. The Commonwealth has responsibilities, the state government has responsibilities. And so what we have done is we are working together. We have established the Victorian Aged Care Response Centre, led by Joe Buffoni from Emergency Management Australia, bringing together, Mr Speaker, a series of professionals, whether it be in the health sector or other sectors, that are responsible for ensuring we get the right outcome. And again, Mr Speaker, I remind people, despite the fact that we have had unacceptable outcomes in less than half a dozen facilities, Mr Speaker, and that a total of 16 have been considered to have a significant impact, 97% of aged care facilities in this country have had no COVID infection. 97%, Mr Speaker. And in Victoria, where there has been a significant outbreak, more than 90%, Mr Speaker, have not had a COVID infection. And I think the Victorian Aged Care Response Centre, under Joe's leadership, is doing a great job. And I want to thank the Premier of Victoria for his cooperation, working with me, and the Minister for Health, working with his counterpart in Victoria, Mr Speaker, and the Minister for Aged Care and his counterpart in Victoria, working together to ensure that we can protect lives in aged care facilities and throughout Victoria by working together.
I call the member for Boothby.
Thank you, Mr Speaker. My question is to the Minister for the National Disability Insurance Scheme and the Minister for Government Services. Will the Minister please update the House on what steps the Morrison government has taken to ensure vulnerable Australians living with disability are supported during the COVID-19 pandemic, especially in Victoria?
The Minister for National Disability Insurance Scheme and the Minister for Government Services.
Thank you, Mr Speaker. Can I thank the member for Boothby for her question and her strong advocacy for the 3,475 participants in her electorate. Government commenced planning for issues of disability when COVID started striking in February. We've followed this plan. We've been updating it ever since. Disability ministers from around the country gathered on the 18th of March, and we've gathered 4 times together to ensure the needs of people with disability throughout the pandemic were considered and responded to quickly. We established the Disability Information Hotline to provide information and support to people with disability, and then in early April to build on these plans both at the NDIS and at the national state level through the DRC. We established an advisory group to develop and implement a further management and operational plan for people with disability as part of the Australian health sector emergency response. And the first version of this was released on the 18th of April. We moved quickly to provide access to personal protective equipment, PPE, for self-managed participants and providers from the national medical stockpile, where they're able to access via, if they are unable to access via normal channels. We've allocated currently 1.5 million masks to that area. Participants who are receiving face-to-face supports in New South Wales, Victoria and now the restricted areas of Queensland are now able to claim the costs of all the PPE through their plans, and providers in those areas can claim the costs of PPE directly from the agency. Indeed, in Queensland we put this in place within hours of the public health alert that came out on the weekend. We've proactively spoken to 67,000 vulnerable participants right across the country, including 7,000 participants in Victoria. Planned flexibility has been introduced, including with assistive technology such as iPads for participants who can't leave home. For children and families, we've ensured existing core supports can be used flexibly to provide disability-related supports at home to assist participants, or frankly to give mum or dad a break if they're caring for a child at home who would normally be at school. Additional funding is available for deep cleaning. Indeed, in Victoria, we've established 4 very large providers as providers of last resort to ensure additional workforce capacity and support is required immediately if needed, and Aspen Medical has been has been contracted with to provide a clinical first response. The pandemic leave disaster payments are also available, of course, for everyone in Victoria, and we're also working closely with all state governments in terms of their planning, including with Victoria, where we've been part of their Disability Rapid Response Group since the 29th of July. All of these measures are designed to keep people with disability safe and to ensure they continue to receive the supports that they need. And on this note, can I thank all of the state disability ministers for the hard work they're doing with the Commonwealth to ensure we can deliver responsibly.
The Prime Minister.
Speaker, after extending question time for 25 minutes, I ask that further questions be placed on the notice paper.
Thank the Prime Minister.